Okay, so this is the fourth and final pharmacology video, and it is for neurological. And the drug I chose was carbamazepine, brand name Tegretol. It is an anticonvulsant, and it is basically used in patients who have a seizure disorder. It can also be used with trigeminal neuralgia or diabetic neuropathy. And basically, its mechanism is that it slows the activity of the seizures in the brain. And there are so many indications, things you have to watch for with this drug, interactions. If the patient, so just to name a few, if the patient's ever had bone marrow suppression, if they cannot, would not be a candidate. This Tegretol can interact with amitriptyline, doxepin, or nortriptyline. If they've ever had weird blood problems. There are 2 different life-threatening rashes that can occur on this medication, and it's actually a genetic disposition that would cause this, and it's more people with Asian descent. So if a physician felt that they wanted to prescribe Tegretol and that the patient might be at risk for this genetic abnormality, there's a blood test that, like the genetic testing, they could have done. But those rashes are called toxic epidermal necrolysis, and then there's one called Stevens-Johnson syndrome. And those, like I said, can both be life-threatening. Some other things, side effects that the actual med can cause is fever, weakness, increased bleeding or bruising, blisters or peeling on the hands and feet. It does have an increased risk of suicide, so you definitely want to know the mental health history of your patient. It is a pregnancy class D. It cannot be used in pregnancy. It cannot be used with MAOIs. It should not be used in people with liver and kidney problems. It can make birth control less effective. So like I said, there's just tons of, rules and restrictions on this drug. It's one of those that they don't want you to eat grapefruit, take any kind of grapefruit juice. It can also, more common side effects is shortness of breath, headache, confusion. In some patients, it can increase seizures, and you want to watch for hyponatremia. It can also increase cholesterol or lipid numbers. So we'll get to that in a minute, kind of like the baseline testing that you want to have done. Some of them, the forms that comes in, it can be tabs. There's chewable tabs, regular tabs, extended release, and then it also comes in a suspension. And most of the time, doctors will kind of start low and slow and then increase the dose as needed. That can be over hours or days. And then if the patient ever has to come off of the Tegretol, it has to be gradual. And that's important patient teaching, is that they can't just stop this medication. There is no real antidote if the patient had too much. From what I read, they would induce vomiting in the ER, kind of assess what's going on. And then it's usually not used in a mixed seizure disorder. It's more that can cause more issues. But some of the things, the baseline testing you want to do, a blood panel, CBC, an iron level, LFTs, an eye exam, because it can increase intraocular pressure. So you want to make sure your patients are getting their eyes checked regularly. You want to check a UA and then a thyroid panel. Tegretol can be used in children. There's a whole table online about, dosages and weights. Like I mentioned, it's a class D in pregnancy, and there's no studies online I could find or in the med book about geriatric population. So, like I said, it's a lot. It's a very complicated one. I felt compelled to pick it because I feel like there's a lot of information about it, some very life-threatening side effects to watch for. And so we're going to get ready and go give it to our patient. Okay, so this is our patient Jill, and she is a new onset seizure disorder. She is going to take Tegretol 100 milligrams. She has been given all the instructions of side effects, things to look for. She'll be going home on this medication to help with her seizures. Have any questions?
I do not.
Thanks, Jill.